Hey guys, this is Dr. Charity Stanley, and today we're covering thyroid and parathyroid issues. So, the thyroid is a butterfly shaped gland that's in the front of the neck, and it responds to thyroid stimulating hormone that's sent down from the brain, and it responds with making thyroid hormone T3 and T4. And then the parathyroid glands are four teeny tiny little sesame seed shaped glands that are stuck onto the back of the thyroid. And the parathyroid is involved in calcium absorption in the body. And we'll be talking about that more in just a little bit. So with the thyroid produces several hormones. So when it's a negative feedback cycle, like we've talked about. When there isn't enough thyroid hormone, the brain will release thyroid stimulating hormone from the anterior pituitary gland. Thyroid stimulating hormone goes down to the thyroid and actually kind of irritates the thyroid, pokes it, and says, hey, make me some T3 and T4. And so, as that T3 and T4 is secreted, it should go back and be sensed by the hypothalamus and the pituitary and turn off the secretion of thyroid stimulating hormone. If it does not, that is when we have cases of when good thyroids go bad, and we have too much thyroid hormones secreted. And we'll be talking about when you have too much and when you have too little thyroid hormones secreted. It creates two entirely different issues. Okay, so the thyroid gland is wrapped around the trachea. Again, it's a butterfly shaped gland and it's right under the Adam's apple. So we talked about that the thyroid is monitored by the hypothalamus and the anterior pituitary gland. And with that, it creates thyroid stimulating hormone to go to the thyroid to tell it to make T3 and T4, which in turn turns off the secretion of thyroid stimulating hormone. The main hormones you need to know about with the thyroid, the first is thyroxine. So T3 is converted into T4, and this regulates metabolism of almost every body system. Another hormone is calcitonin. Calcitonin, it helps to reduce blood calcium levels. It takes the calcium that is in the blood and it will squirrel it away and pull it out of the blood and store it in the main places where calcium is stored in the body, in the bones and in the teeth. So calcitonin decreases the blood level of calcium because it's squirreling the calcium away for another day. And then parathyroid hormone does the opposite of that and breaks down bones to put the calcium back in the blood. So to make thyroid hormone, you have to have enough protein and you have to have enough iodine to be able to secrete the thyroid hormone. Hyperthyroidism. With hyperthyroidism, we have too much thyroid hormone. This is when people are very heat intolerant. It's going to be the Energizer Bunny. So these people have tons of energy. They tend to be slender because their metabolism is burning so many calories all the time. So with hyperthyroidism, this is where we have excessive secretion of T3 and T4. This is called Graves' disease. It's an autoimmune condition where the thyroid gland is being attacked and being told to keep making more thyroxine hormones. And so the thyroid stimulating hormones aren't being listened to because the TSH levels actually tend to be lower in this unless it's a problem with a pituitary tumor with excessive TSH secretion. So what happens in Graves' disease? You have too much T3 and T4, and it turns up your metabolism way too high. So with Graves' disease, you tend to see people who have trouble sleeping. They're the Energizer Bunny. Go, 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 go. They're heat intolerant. They cannot deal with hot. They tend to lose weight because they are burning so many calories. They tend to have high anxiety levels and be very nervous. So the thyroid gland is usually enlarged. They may be going into cardiac arrhythmias such as atrial fib too. And they also have exthalamosis. Exthalamosis is caused by additional fat packing behind the eye, and that additional fat behind the eye causes the eyes to actually bug out within Graves' disease. Now, hyperthyroidism is where everything is running too fast, too high. Hypothyroidism is where everything slows down and gets very sluggish. A goiter. A goiter is not diagnostic. What this means is the presence of a goiter can be there when a person has hyperthyroidism or when they have hypothyroidism. And so goiters are seen a lot more in other countries than in the United States because in the United States we iodize our salt, and iodine is needed by the thyroid to make thyroid hormone. So again, they're going to have an enlarged thyroid. They're making too much thyroid hormone, and their eyes will appear to be bugging out from the fat deposits behind the eyeballs. So, diagnosis of Graves' disease, high T3, high T4, low TSH, unless there is a pituitary tumor or something is causing increased thyroid stimulating hormone. But remember, it's a negative feedback system, so it should not be high with high T3 and high T4. So radioactive iodine scanning, and they can measure the amount of iodine that's taken up to see exactly how active that the thyroid is. So in Graves' disease, again, higher metabolism, the amount of iodine that's taken up is increased. So there's several diagnostic procedures that can happen with thyroid disorders. One is an ultrasound just to be able to look at it, see what's going on, measure it, see if it's enlarged or smaller. Electrocardiogram, this is going to be used to examine the higher metabolism of thyroid hormone being constantly activated, namely fast heart rates or have dysrhythmias. You may see some atrial fibrillation and you may see some other nonspecific changes on the EKG. A thyroid scan is a nuclear medicine test. This is going to help determine and define the size and if the thyroid gland is functioning. It's going to measure the amount of radioactive isotope that is being absorbed, and an elevated uptake is an indicator of hyperthyroidism. So the way we treat this, we first treat our patient, not our lab values, and we use anti-thyroid hormone medication. And so we try and block the thyroid hormone to decrease the metabolism within the body. And we also will use radioactive iodine. And this radioactive iodine will help to destroy part of the thyroid and subsequently have less T3 and T4 that's being produced. Now, if I do either the radioactive iodine and kill the thyroid, or I have surgery and remove part of the thyroid, or even all of the thyroid, you will need to take levothyroxine for life. So with Graves' disease, you want to cluster your care, provide a calm environment. Remember, your patient's going to be excessively nervous. Assess their decision-making abilities. Make sure they're eating and they have adequate caloric intake for the amount of energy that they are expending. Monitor eyes and nose daily. Make sure the room is cool. Remember, hyperthyroidism, everything's too high. They cannot tolerate heat. You don't want to have hot showers. You want to have tepid showers or a cooler shower. And you need to make sure that if the body temperature increases by 1 degree, this can be a sign of thyroid storm, better known as thyroid crisis. But you need to report this because your patient could be tanking very soon. And you also want to avoid any excessive palpation of the thyroid because as you are touching the thyroid and moving it, you actually are increasing the secretion of T3 and T4 from the thyroid. Medications that are used during hyperthyroidism is thionamides, beta blockers, and different iodine solutions. Thionamides are used to treat Graves' disease, and it's often used in conjunction with the radioactive iodine therapy. So, another major medicine that's used is PTU, propionthiouracil. And so that can also inhibit the production of the thyroid hormone. So you need to monitor for signs of hypothyroidism. If we are doing things to block the thyroid hormone, we can throw them into hypothyroidism from hyperthyroidism. Now, the major signs of hypothyroidism tend to be the opposite as the signs for hyper. So in hyperthyroidism, they tend to be very hot. Hypothyroidism tend to be very intolerant to cold, swelling, their heart rate will slow, their weight will increase, and they tend to be depressed. Iodine solutions. So Lugol's solution is a non-radioactive iodine solution that helps to decrease the rate at which thyroid hormone is released. So this can only be done for a short-term solution. What you're basically doing is trying to decrease the size of the thyroid by blocking the amount of thyroid hormone being released. And this helps to make it less vascular. So when you take it out, it's actually safer for the patient. You always want to use a straw because just like iodine will stain clothing, iodine will stain your teeth as well. Should also be taken with food. This should not be done during pregnancy and under any circumstances. Other things we can do to help decrease the thyroid hormone levels is radioactive iodine therapy. We can also take out that thyroid. Radioactive iodine therapy. What this does is they will take a radioactive seed and plant it on the thyroid. Now, you need to be doing radiation precautions. What this means is you can't be around pregnant women, you can't be around children for up to a couple of weeks. You need to be isolated with your own bathroom. Your urine and your feces will be radioactive. You need to flush the toilet multiple times to be able to help decrease the amount of radioactivity that your loved ones are exposed to and that you are exposed to. Okay, so this is a slide showing what they do. You place radioactive iodine seeds on the thyroid, and then it will be absorb that radioactive iodine and start to destroy part of the thyroid. This again is contraindicated in patients who are pregnant. Under no circumstances do you do this. You need to constantly monitor for hypothyroidism. With this, you're going to have edema, intolerance to cold, and your patient is going to be very, very uncomfortable. Okay, so preventing radiation exposure to others. You've got to make sure that you don't use the same bathroom as other people for 2 weeks. Make sure males or females, make sure sitting down to avoid urination, urine splattering different places and making more areas radioactive. You need to flush the toilet multiple times after either peeing or pooping. Need to be sure and take a laxative to avoid straining. So wear clothing that is comfortable, is washable. And honestly, a lot of people actually will wear clothing that they just plan on chucking at the end of this. And so you want to not share a toothbrush with others, not share saliva, use disposable food items and silverware when you have this radiation, active radiation in the body. Thyroidectomy is a surgical removal of part of the thyroid gland. So a subtotal thyroidectomy is where we don't take out the whole thyroid gland. We just take out part. It's often used if a patient has thyroid cancer or that they have a goiter that needs to be corrected. So a total thyroidectomy, you take out the entire thyroid gland and you're going to need to be on thyroxine for the rest of your life. So patients will need to follow a high protein and high calorie diet prior to. So taking out a lobe, we're taking out one half. A subtotal, a thyroidectomy, we're taking out a portion. And a total, we're removing the entire gland. Remember, for a total thyroidectomy, they have to be on thyroxine, levothyroxine for the rest of their life. So before the procedure, make sure the patient understands what's going on with the procedure. They're going to be receiving PTU before to help decrease the amount of thyroid hormone that's being secreted and to decrease the vascular nature of the thyroid. And so you need to also be making sure they're taking iodine to help reduce the bleeding and reduce how vascular it is. Keep the patient in semi-Fowlers. Do not lower them because this bleeding in the neck can compromise the airway. So you want to support the head and neck with pillows. Avoid neck extension. You don't want to do anything that's going to stretch that incision and tear that incision. So, following protocol, this is a very significant surgery because you're working around the airway. You need to do vitals every 15 minutes until they're stable, then every half hour. Make sure you're checking for bleeding with the surgical dressing and know that you need to be watching the airway because once it is compromised, the patient is in big trouble. What do you need to have after a thyroidectomy? Need to have calcium because remember those parathyroid hormones or glands can actually get taken off accidentally during a thyroidectomy. Make sure you have oxygen available. Make sure that there is an emergency trach kit in case the airway is compromised. You still can get an airway on that patient. So need to make sure that you're checking for hypocalcemia, and this can result from parathyroid damage. And so checking for Chevotec and Trisozide, calcium gluconate needs to be available in case you need to emergently replace that calcium. So trousseau sign is when we put a blood pressure cuff and inflate it on the patient's arm. The hand will contract and pull back, and the fingers will start twitching. That's a sign of low calcium. The second thing you need to look for is Chevotec sign. This is when we touch the side of the face, stroke the side of the face, that the entire facial muscles on that side will contract as a direct response to that touch. Post-surgical complication may end up with tetany from the calcium issues, respiratory distress, may end up with hemorrhage, thyroid storm, or having severe neck edema that can compromise the airway. This is what the dressing looks like after they have had thyroid surgery. And so you will be looking at this dressing for bleeding. If you see bleeding, you're not going to take the entire dressing off. You're just going to reinforce it, add more dressing and more tape to be able to absorb it. Thyroid storm. This is when there is a ton of thyroid hormone being released at one time, and this kickstarts the metabolism and makes it even faster than it was with Graves' disease. This is a true emergency. It stimulates the metabolism, causes high fever, agitation, can cause psychosis, can cause cardiac arrhythmias. So often, thyroid storm is precipitated by surgery or by trauma, and it is a true medical emergency. So this video you can watch later. Thyroid storm, what do you need to do? Make sure the airway isn't compromised. Get a tele box on. Make sure you're monitoring that heart rhythm. Make sure that the body temperature isn't getting too high. If the body temperature gets too high, they will start seizing. And so aspirin is contraindicated in thyroid storm because it can cause thyroxine to increase within the body, and you have too much thyroid hormone as is. Patient doesn't need any more right now. Airway obstruction, use that trach kit that you have by the bed. Keep the patient in high Fowlers. It makes them easier to breathe. And it also helps to decrease swelling of the neck. May have to call a rapid response. Stridor is often an ominous sign. Stridor is due to upper airway obstruction. It's going to be a very loud, shrill sound that sounds something like this. And that's a sign of an upper airway obstruction. Okay, having too little calcium can cause tetanus. And so that's when the muscles seize and they spasm and you're not able to get control. Now, patients with low calcium often have seizures, and you need to have calcium glutamate available for emergency administration. When you're doing surgery on the thyroid, you can accidentally harm the larynx, and that can harm the vocal cords. So you need to monitor the patient's ability to speak for 2 hours, after every 2 hours after they have any kind of thyroid surgery. Kind of compare that patient's voice to what it was before the surgery and notify the provider if there's anything bad happening. Okay, we will stop here for this one and we will start again. I'll see you on the next video. Thank you very much.